are VetMed, and today I'm going to be talking all about a condition known as syringohydromyelia. Let's get straight into the video. First and foremost, although not every dog actually shows clinical signs of syringohydromyelia, there are a range of serious clinical signs. Clinical signs it's the phrase that we use to replace symptoms because animals can't tell us how they feel. The first clinical sign is often intermittent back and neck pain, and it's also mixed with a lot of itching. There's a reluctance to jump and climb after a while, perhaps with whimpering. There's phantom scratching, so the dog's paw almost doesn't seem to reach the neck sometimes. They're biting their paws and scratching a lot, and that's often mixed with yelping, crying while itching or moving. And then in the later stages, you'll notice weakness and wobbliness due to the chronic nerve damage that occurs as a result of syringohydromyelia. So what is it? Well, syringo links with syrinx, which is referring to cysts. So we have water fluid-filled cysts in the spinal cord. The other question, of course, is what causes this, but we'll look into that in just a second. It's important to understand the etymology of the actual term first. Now, for the diagnosis of this particular condition, the most recognised route for diagnosis is almost always magnetic resonance imaging, which is otherwise known as MRI. Apologies for the typo. Now, on the MRI, you will actually see these syrinx, these cysts in the spinal cord, and that's going to make it nice and obvious for us to pick out and diagnose as syringohydromyelia. And now for the etiology. The two most common etiologies, otherwise known as causations of syringohydromyelia, are actually two specific situations in which either the dog has a foramen magnum, that's the hole in the skull that lets the spine go into the brain, or meet the brain, should I say. The foramen magnum is too small and it causes a build-up of cerebrospinal fluid in the spinal cord. The other option is that the dog's brain is actually too big for its skull due to bad breeding, and the brain is actually pushing into the spinal cord. Both situations are pretty dire, if I'm honest. Now, brachycephalic dogs, brachy meaning small, cephalic meaning headed, small-headed dogs are at a very high risk of developing syringohydromyelia. As young as a few months old, all the way up to about 6 years old, this can start showing clinically. This is, for example, Chihuahuas, Bulldogs, Cavalier King Charles Spaniels, etc. Now, treatment's a complicated one. Usually, passively, we would manage this with pain medication. Usually, a vet would prescribe something like gabapentin. In the other situation, when it's very serious and the dog's very young, it's got a life ahead of it, then we might actually be looking at affecting the relationship of the foramen magnum to the spinal cord by essentially widening it. Now, if you look here, this is a normal MRI scan, just reminding you this is normal. We've not got areas of cysts and fluid buildup. But now if you look here, can you see where I'm circling? You can see these cysts of fluid building up on the outside of the spinal cord, and in the next image you're actually going to see them build up within. But here you can see along the sides we've got this real inflammation. Now you can see a little bit of liquid, there's cerebrospinal fluid anyway going along there, but seeing that much is strange. And there is a cyst right in the centre of the spinal cord, and if you look very closely, not only is there also a cyst along the side of the spinal cord, but can you see the brain is just stretching into the area of the foramen magnum, which is very, very much not what you want to see. Thank you so much for listening. I hope this was helpful to you. Tschüss.